Hey Fred, you say a friend has told you to use a massage cane to get rid of that pain in your neck? Not quite sure how to do it? I've got a few ideas. Would you mind if I show you? Learning how to do home massage can be pretty helpful for chronic pain syndromes, muscle knots, and tissue that's stiff and not very mobile. The classic is the Theracane or massage cane. And today I'd like to show you a few techniques on how to use this to get the most out of your recovery. Kelly Starrett, a doctorate of physical therapy, you can check out his information on the Ready State or Mobility WOD, talks a lot about tack and floss, which means to press down on the tissue and move it around to try to break up some of the adhesions. Your muscle fibers are a little bit like rubber bands. When they are young and supple, they stretch and flex and go back to their normal shape without any problem. And as we use and abuse ourselves or recover from injuries, your body puts down basically scar tissue to try to heal some of the damage. The problem is that scar tissue does not bend, twist, flex, or stretch like normal tissue, and then it can end up being stiffer and causing pain. An analogy that I like to use is if you had a bundle of spaghetti fibers and you just dropped them into the boiling water for a second and pulled them out, you might notice that they're stuck together in the bundle. And one of the best ways to get them apart would be to smash and grind them. And that's a little bit what we want to do with our own muscle fibers. Using a massage cane, you can find a sore spot or a muscle knot, and many people, there's a spot right here in the back of the shoulder where the trapezius and the levator scapula can get a little bit gluey. And what you might do is put some pressure where it's tender, and then with the arm on the side that's affected, you want to move it around through a range of motion. You can adjust it as it slides off. And the idea here is that by putting pressure on the tissue and then moving your muscles through its normal range of motion, you want to think about rotation, elevation, flexion, and extension. That can help get some of the fibers unglued and moving normally again. You might have a spot in your lower back, in which case you can kind of flex and extend your lower back, trying to gently push into the point of pressure. You find where it hurts and flex your muscles and your back to push into that point of pain just a little bit. Like with everything that we do here, we want to be able to do it with a calm face and not a wincing face. So pay attention to your own level of comfort and follow that.